Hello, I'm Matthew Weinstock, Managing Editor of Modern Healthcare. Thank you for tuning in to the latest edition of the Checkup. So attention to clinician burnout and staff well-being was certainly heightened during the pandemic, but many of the underlying causes for clinician burnout have been around for years and they've been debated for years. In fact, in Massachusetts, after a hotly debated nurse staffing ballot initiative failed in 2018, key stakeholders from across the industry came together to try to talk and find common ground for addressing some of those problems. The result was a task force report that came out earlier this year with a host of recommendations on everything from workplace safety to staff development. I'm pleased today to be joined by Steve Walsh. He's president and CEO of the Massachusetts Health and Hospital Association to talk about the path forward for the industry, for the MHA's members and everyone else in the industry. Steve, thanks so much for being with us today to talk about this really important topic.
Thanks, Matthew. Really appreciate you having me.
Sure. So I provided a little bit of the backdrop for the task force. Came out of that nurse, patient, staff ballot initiative that failed in 2018. But maybe you could provide a little bit more backdrop on how you pulled together such a diverse set of players. It was MHA, it was the nurses unions, some educators from across the state. Talk a little bit about how that process unfolded.
Yeah, thanks. And it's a good question. The ballot question brought up a lot of interesting conversations around how we operate our acute care hospitals. And some of those conversations were necessary. A lot of them were, frankly, and the industry has been changing. And so we always said throughout question one that it wasn't that there weren't issues, it was that this wasn't the right solution. And so we had made a commitment that we would try to bring together really the best and brightest from all across the industry to have a conversation about what really would improve patient care, would improve clinician burnout. We had heard for many years about physician burnout, but as we all know, it isn't just physicians, it's really everybody that is working within our facilities. Our patients are sicker than they've been, the stays are shorter, and it is a really, really hard job for our caregivers. And so this group was about how do we improve the conditions and how do we do it in a way that makes sense?
And so, as you say, that focus on patient care was that seemed to be the driving force behind it all, right? It wasn't necessary. I mean, I'm sure clinician burnout was a big piece of it, but at the end of the road, it's how do we care for patients in a more efficient and safer manner?
Look, everything we do is about patients. I mean, every single thing, patients should be at the center of all the decisions that we make, no matter what it is. That's why we are in this business. We're here to care for people. And so we need to be able to make sure that our physicians, our nurses, our clinicians, and everyone that's working within our facilities is healthy in order to be able to provide the best possible care for our patients. That's really what it's about. Of course, the past 16, 17 months has only exacerbated some of these challenges. And we didn't even foresee COVID, nor did anyone else when we were talking about these issues at the beginning.
Yeah, and we're going to touch on COVID in a little bit. A couple of things in the task force report that sort of stood out to me as you look at all the recommendations, and there are a host of them in that report, but it seemed like there was a pretty big onus on data collection and culture change. So if we could talk about data collection first, where were you seeing gaps in data collection, and why did that become such a focal point for almost every part of that report?
Well, there's been this one of the things about technology is it can truly improve patient care. It can truly help with a divide in geographically isolated areas and finding the best clinician or physician to see for a given circumstance. But it is really destroying the relationship between patients and their providers within hospitals. And it is making it incredibly hard for caregivers at the bedside to be able to do their job. And if you really look at the way we have moved towards the EHRs over the last few years, and the amount of time and clicks it takes to do anything, it really has taken away from the core focus, which is the patient. And we're there with an iPad, or we're there with a computer, or we're rolling a computer in, we're rolling a computer out. It has both contributed to burnout. It has contributed to folks not being happy in the workplace environment anymore. And frankly, that can end up harming patient care.
Yeah, and a report came out earlier this, or just around this time this month, about looking at poorly designed usability within EHRs is actually causing more clinician burnout and patient safety issues. So you're not alone in sort of honing in on that one area.
Yeah, and maybe we want to sit with the caregivers and talk about what's going to create that best system, right? That necessarily shouldn't be created by somebody who is technically savvy. It should be created by somebody who understands the needs of the patient and how to best talk to the patient. And when you even just begin to look at how to eliminate some of the additional stresses around data collection in a hospital, you immediately see an improvement in culture, immediately see an improvement with your caregivers, and then ultimately that leads to an improvement in patient outcomes.
And so as you think about how your members start to embrace some of the task force recommendations, where are they starting on this front? What are they doing to get the ball rolling?
Yeah, so one of the first areas really was around safety. I mean, that is, it is both safety for our caregivers and safety for our patients. And it's safety in two ways. It's safety in terms of prevention of violent acts, which we're seeing more and more of in our facilities, which is an unfortunate occurrence now. And it's also safety in terms of any mistakes or slips or falls or any workplace issues. And so that's an area that we can focus on right away. Some of the changes in terms of engagement and well-being, they take a little more time. It takes time to change culture. It takes time to drive change. It's going to take time to change the way we operate within our EHR. But some of the prevention efforts are something that we've been starting immediately and that our member hospitals have been embracing.
Got it. And one of those things I think that seems like it will take time too. The report puts a lot of onus on leaders really to become more engaged in the process, whether it's leadership training or fostering engagement, promoting well-being. Again, how do you have those conversations with your CEOs across MHA about changing the culture of an organization?
Yeah, so our CEOs have really embraced this, I think, and I think you're seeing it as a national trend as well. You're seeing CEOs more and more, right? The CEO is a lonely job. Oftentimes you're in the office and you're hearing all the negative. And I think when our CEOs get out of the office and into the building and they're rounding and they're doing the town hall work and they're doing meetings with their employees and they're talking to patients and they're moving freely through their facilities and they're talking about improvement, it makes for a better CEO. But it makes for a better facility and a better patient experience because things start to change. And our CEOs have been doing that. And that is the single biggest thing I think that drives culture. Our CEOs working together, putting some of the competitive nature of the business aside and embracing best practices in terms of how to have a healthy and happy workforce.
Got it. One of the other things that's going to take time that the task force looked at was that workforce development and the pipeline of people. So there's, just a staffing shortage and staffing part of it, but also something that, certainly came up during the pandemic of letting people practice to the top of their license, which, isn't always embraced by some of the medical societies in the AMA and elsewhere. So how do you start addressing some of those workforce development issues in Massachusetts?
Yeah, and that, if there's a few things or learnings that could be important that came out of COVID, this is certainly one of them. I mean, it shouldn't take a 100-year pandemic to allow people to practice at their top license and figure out how to credential people quickly so they can get to the bedside. I think we learned some of that. But I think you're right. I mean, the workforce challenges, if you look at all the national trends, we have a problem. People aren't going into the field the way they once did. And there's ways to do that. There's ways to introduce mentorship program and go into high schools and get people in. And it's a big charge of ours in terms of health equity as well. And making sure we're going into communities of color and encouraging people to come into the medical field. But the one place that it is the most serious concern today is behavioral health. The behavioral health challenges of our communities and our country is really the epidemic within the pandemic. And there is a workforce challenge that is acute, and we're feeling it within our behavioral health spots, because it's something that we're trying to address immediately.
Are there things that you're doing in Massachusetts to try to get at that problem?
It's some of it is around reimbursement. I mean, some of it really is around looking at making sure that we're investing in behavioral health the same way we have invested in other areas in healthcare, and making sure that we are treating holistically the whole patient. And that's starting to take effect. But then ultimately, it's paying more, it's training programs, it's identifying gaps and making sure that we're seeing them 3 years and 5 years ahead of time. So it's going to take a little bit of time to get it right. But we are really, and I think Massachusetts has done a good job looking at behavioral health in three ways: reimbursement, bed capacity, and workforce, and trying to find areas to address each of those.
Got it. So, Steve, if we pivot a little bit to, and this is clearly a workforce issue that we're seeing now, which is COVID, vaccinations, and mandates, right? So we're seeing a lot of conflict between, health systems that are starting to mandate that their staff get vaccinated. We're seeing some resistance in the workforce to do that. Some lawsuits, including down in Houston, that's become very well publicized.
Right.
How do you start to talk about that with staff, with your member hospitals and with staff, and the importance of the vaccination? How does that feed into all of this?
Yeah, it's an incredibly poignant question, and it is actually it's fairly easy to look at the evidence on this. Early on in COVID, our workforce was out, right? We had a real challenge in finding workers, and at least in Massachusetts, as they did in some other states, we prioritized the vaccination of healthcare workers. When we did that, we saw our workforce come back to work. And it became very real that in order to meet the needs of the patient, our workers had to be vaccinated so they weren't sick, that they were taking care of themselves first. And it is the best evidence in terms of mandating vaccinations for healthcare workers that you will see, because if we are not healthy, if we are not there, we can't meet the needs of our patients. And if you bring up Houston, we're having later this week a webinar with the team from Houston to better understand some of the challenges they're seeing and some of the steps that they're taking. But I think you will see more and more places and more states begin to do this in the next several months.
Is it as simple as just the word, mandate, versus we hear a lot in other avenues, if we put the data in front of clinicians, in front of physicians, they'll flock to the data, right? So is it just dealing with the way we phrase it, or is it deeper rooted than that?
I think there's obviously a couple of schools of thought or where or why, but I also think we have to remember it's been a long year and a half. And although it feels incredibly long, in the timeline of a vaccination or in the timeline of a disease, it is a microsecond. It is so quick that let's give it a little more time. Now, mandate may be a word that concerns some, but let's meet people where they are. Whether that's their restaurant or their barbershop or their church, place of worship, their community, their neighborhood, their health center, and have the conversations. And let's not rush to judgment for people that have concerns about a vaccine, but educate and talk about it and talk about the importance of it. Getting back to this new normal, being able to get back and see my kids play Little League again. That's really, we took all that stuff for granted before, and we're able to do that now because of this extraordinary vaccine and the vaccination programs that states have done. And so we'll get there, but it's going to take a little time.
Right. And Steve, I want to kind of circle back to, the task force and obviously the conversations that are happening under vaccination, I think feed into this last question. But how do you build on the momentum of what you had in the task force, underlying the mandates that are coming on the vaccinations, but really how do you build on that momentum and make sure that you keep these disparate parts of the industry talking together on clinician burnout, staff well-being, and moving forward, as opposed to falling back in their silos and sort of butting heads again?
Yeah, there's a great story one of our CEOs tells about in the middle of COVID. We went out to the parking garage and seeing a nurse in the corner of the parking garage, right? Take off scrubs, take off shoes, put them into a trash bag, tie it up. It was different, and it created a level of profound collaboration that has to stay, to your point. And so I think as we look at the future, if we look at shared opportunities for governance, shared opportunities for input, making sure everybody within the walls of the facility or the provider has a seat at the table to help make the policies that are going to make our patients healthier moving forward, it can work. And I think it's what started with our task force and these recommendations. And it was seen in COVID as to how it can really work when we collaborate and we put our differences aside and we talk about putting our communities and our patients first. And I think it will continue in the future with vaccines and with other priorities that we have. And I think we've seen a real movement towards our clinicians, our caregivers, and our management teams working together. And I think that's going to be the best strategy for us moving forward.
Got it. Well, Steve, we really appreciate your time talking about this very important issue of addressing clinician burnout, staff well-being. We'd love to stay in touch as these recommendations from the task force roll out. But again, thank you so much for taking some time with us today.
Thanks, Matthew, and thanks for all that you continue to do every day.
Thank you. And I'm Matthew Weinstock with Modern Healthcare. Be sure to come back next Monday for another edition of The Checkup.